Today we will be talking about expanding access in underserved communities for mental health. My name is Feryeni, and this is.
Lauren Ward. I hope you enjoy our presentation. The lack of access to mental health services in underserved communities is a growing concern. According to the American Public Health Services, underserved communities face significant barriers accessing adequate mental health services. According to the National Alliance on Mental Illness, 1 in 5 adults experience mental illness, yet many underserved areas lack the necessary services to receive appropriate care. Factors contributing to this lack of access include stigma surrounding mental health, limited availability of mental health professionals, and insufficient funding for mental health programs. Addressing this issue is crucial to improve the overall health and well-being of communities. When mental health needs go unmet, individuals and families face increased risk of homelessness, substance abuse, and preventable health issues.
Why is this issue important? Mental health is a crucial component of overall health. Inadequate access to mental health services can lead to negative outcomes such as poor academic performance, increased poverty, and higher rates of chronic disease. Children and adolescents are especially vulnerable without timely interventions. Mental health issues can lead to developmental delays, social isolation, and difficulty transitioning into adulthood. Expanding mental health services is particularly important for reducing health disparities and promoting equity in underserved populations. Access to mental health care can improve school performance and reduce crime rates and lead to more productive members of society.
Legislative efforts and advocacy. One current policy is the Mental Health Services for All Act, which aims to increase funding and resources for mental health services in underserved communities. The bill also focuses on expanding telehealth services, which is critical for reaching rural and isolated communities that lack mental health professionals. If enacted, this bill will improve access to critical services, enhance community well-being, and reduce the long-term costs associated with untreated mental health conditions. Additionally, the Mental Health Parity and Addiction Equity Act seeks to ensure the mental health is treated equally to physical health in terms of insurance coverage, thereby increasing access to services for those in need.
So, strategies for advocacy as a nurse. You can join a professional association like the ANA to help advocate for increased funding and legislative support for mental health initiatives. The NAA provides resources for members to engage in policy discussions and access to networks that amplify advocacy efforts. Community engagement, collaborate with local community programs to provide education on mental health resources and engage in initiatives that support mental health wellness, such as community garden programs. For example, the Healthy Start program integrates gardening with mental health services, resulting in improved nutrition and emotional well being among participants. Nurses can volunteer to facilitate these programs, offering mental health education alongside physical activities. Policy advocacy advocate for increased funding for community health centers to expand their mental health services, particularly for low income families. Writing letters to local government officials or participating in town hall meetings can help bring attention to the issue and promote policy change.
Rationale for supporting the issue. Expanding access to mental health services will lead to improved quality of life, reduced healthcare costs, and greater health equity for underserved populations. Community based programs like Harvest for Healthy Kids have demonstrated the benefits of integrating mental health and nutritional support to enhance both physical and emotional health. The combination of accessible mental health services and good nutrition can lead to reduced anxiety and depression rates among children. Evidence suggests that early intervention through accessible mental health services helps reduce emergency room visits and inpatient hospitalization, which lowers overall healthcare costs.
Call to action: get involved. Contact local legislators to express support for the Mental Health Services for All Act. Explain how this bill will benefit community health and reduce costs in the long term. Provide specific statistics or stories to make a compelling case. Advocacy and practice. Nurses can work with schools and community centers to establish mental health support programs, ensuring that children and families have access to the resources they need. This includes creating workshops on coping strategies, stress management, and recognizing signs of mental health issues. Personal storytelling. Sharing personal stories or patient experiences while maintaining confidentiality can be an effective tool for advocacy. Personal stories help humanize the issue and convey the real impact of inadequate mental health services. In conclusion, expanding mental health services is about building stronger and healthier communities. By advocating for policies, engaging locally, and sharing impactful examples, we can make mental health care accessible, reduce costs, and promote equity.